Namaskar, friends. Today we will look briefly what are the root causes of lifestyle disorders, and also we know fundamentals of health, and also let's look at what is our health score as of now, and what are our goals, and then how do we choose the right diet? Because lots of people diets are available and all that. So we will look at it briefly today, friends. Lack of hydration, poor gut health, inflammatory foods, lack of nutritious food, insulin resistance, lack of exercise, lack of 7 hours night sleep, poor mind management, chronic stress, D and B12 vitamin deficiency over a period of time, it requires 5 10 years. They cause inflammation, hormonal imbalance, friends. That in turn leads to obesity, pre-diabetes, diabetes, hypertension, PCOS, and CVD, etc. Now, what? Look at this one. Constipation is the mother of most diseases. So, friends, if you are unable to pass the stools twice in a day comfortably, partially you are constipated. And then this insulin resistance, we talked on this many times. This can lead to all sorts of health problems like obesity. All that we have discussed it. Now, what is this lifespan, health span, and sick span, friends? See, lifespan is not in our hands. Number of years we live is it is decided already. Health span is mostly decided on, well, depends on our habits and our approach and attitude, friends. So, how do we improve insulin sensitivity? What is insulin sensitivity? This is look at this. Insulin sensitivity improves health span, and insulin resistance increases the sick span. So, what are those parameters? We discuss this. A lot of videos are available in my channel. We can look at that. Let's understand, friends, uniqueness of every human being. Choose your diet accordingly. See, every human is unique and are differing in what age, sex, genes, BMI, number of prescription medicines used or not used, metabolic health, liver health, gut health, acidity level, degree of insulin resistance, hormonal balance or imbalance, stress levels, activity levels, and then food habits, is vegetarian or not, likes or dislikes, environment, social and economic conditions. So many variants are there, friends. So what suits one, we need not suit for other one. So that's what I'm trying to caution you here. Check your health score. See, before you attempting to do anything, find out what is your health score. I have created a simple 11 parameters, friends. In that there are 6 blood tests. I've shared that. You get those 6 blood tests and look at these 11 parameters of yours. Find out where is your health score. Are you at 40%? Are you below 40%? Or you are at a higher percent? Whatever percent you are there, you can still improve by following these lifestyle changes. Now look at, friends, what all can happen. Changes in type of food. See what type of food. Somebody says keto, somebody says plant-based food, and this is a standard American diet, low carb, high fat food. So many options are available. That is one changes in type of food. Frequency of eating. Somebody says you take 6 small meals. Somebody says OMAD means 1 meal a day, 2 meals when hungry. Somebody says what are the fasting and eating windows. Are you fasting for 16 hours or eating window 8 hours, 12 or 12, something like it. Somebody talks about calories. Are you taking 2500 calories or you are taking calorie deficient food so that you can become healthy? See, it can make huge impact. All these four can make a huge impact, either good or bad, on these factors. So hence certain diet plans give good results to a few and not so good results to others. So you have to be watchful. So just because your friend had benefited substantially, don't dive into that because you're different. Now, most of the diets, what do they do? All the best diets, what you see in YouTube or talks and all that, understand, friends, most of the diets help in losing weight. So, what caution one has to take: underweight people, aged people, and people with chronic lifestyle diseases under medication should consult their doctor before adopting any changes in diet plans. It's very important. In the last 8 years, I've been looking at people, they blindly jump onto one diet plan and somebody benefited, somebody are in deep trouble. So watch out. Whenever one changes food habits, what needs to be done? You don't have to listen to anybody, friend. Listen to your body. Track your parameters. Look at what improvements you are showing, and you must take appropriate, timely changes and corrections. Otherwise, you are going to be in trouble. Look at, friend, there are excellent diet plans. These are the things I've researched. Wonderful diets: Dr. Manchana diet, VRK diet, Dr. Jagannath Dixit diet, LMK, Lalit Kapoor diet. Wholesome Health, Colonel Gautam Guha, Common Man Diet, New Diet System, B.B. Chaw's, very famous. And this is a very common thing everybody knows: intermittent fasting, 16 hours fasting, 8 hours eating. OMAD means 23 hours you are fasting, only in 1 hour you are eating. So these are all the fantastic approaches are available. Now, what suits you? How do you do that? Because this is what I have done. This is what I have said, what needs to be done and all that. In my approach, what is important is 3 to 4 liters water, 2 bowel movements, 45 minutes brisk walk, 7 hours sleep at night, eat only twice when hungry, preferably one time natural food, fasting once in 15 days, stress management, 8 key ideal health parameters. You need to check your weight, you need to check your waist size, blood pressure, what is your fasting sugar, what is your fasting insulin, what is your HOMA-IR, and what is your triglycerides to HDL ratio, how is your D vitamin, how is your B12 vitamin. So this is what I approach in a comprehensive approach, friends. As we discussed, what are the fundamentals of health? See, friends, speed is not important, the direction is important. So, direction more important than speed. Many are going fast, but in a wrong direction. So, let's look at this. We have already looked at it. These points we have already looked at it. There are so many videos that are available in my channel. Watch out. Now, what needs to be done, friends? See, whatever diet you are going to adopt, it's all right. But there are certain fundamentals you need, no compromise on that. What are that? We looked at it: hydration, elimination, exercise, avoiding junk foods, and eating twice. Look at what. How do you take it forward? So in the morning when you get up, immediately after get up, you drink 1 liter water. Focus on your stomach. Go for the first bowel movement. I mean first stools. After that, you can go for 45 minutes to 1 hour brisk walk. Come back home and drink again 1 liter water and go for the second bowel movement. This is very very important, friends. Whatever diet you are following, you can follow this. This will give a great results. And understand, don't drink water 20 minutes before eating food, while eating, and until 2 hours after eating. Very essential. Then eat only twice in a day when hungry. Maintain the same timings, whatever your diet you are taking. Look at certain cases, of course, it's not applicable, but by and large, in my opinion, 80-90% people, grown up people, they don't need to eat 3 times, 4 times, and all that. 2 times is sufficient, and that too when you're hungry. Maintain the same timing. So, what type of food you want to eat, what is the quantity you want to eat, what timings you want to take, it's entirely your choice. So, nothing in between 2 meals except water. If you can follow this. Yesterday I was with one of my friend. So we are around 4 o'clock. We were having discussion. Somebody came and offered the Tirupati laddu. So immediately my friend was popping it in the mouth. I said, don't do that. So this is one weakness we all have. If you can just follow this simple rule of not eating anything in between 2 meals, I can guarantee you, without any additional efforts, you will become healthy, friends. Now, for good health, somebody wants to be absolutely healthy, you want to take care of his, get rid of his health problems. Unless, I'm not suggesting for diabetic patients where the sugar levels are high. For good health, eat one time cooked food, second time natural food. What is natural food? I'll just show you, friends. So, between first meal and second meal, you must drink 1 to 2 liters of water in installments. Only in the morning, you have taken 1 liter at one go, and after the first bowel movement, after exercise, you came back and again you drank 1 liter at one go. But afterwards, after the first meal, after 2 hours, you take 1 to 2 liters water in installments until the second meal. Now let's look at what is this natural food. Look at this, friend. This is the natural food. Look at what all we have. We have sprouts, we have soaked nuts, and we have fruits. We have sesame seeds, we have dates, we have cashew, we have chiku and coconut, fresh coconut, and all that. Look at here also sprouts. Look at the papaya, banana, and all those things, friends. And one time you can have a cooked food, friend. You can enjoy, try and avoid white rice and have more of curries and a bit of curd, and this will take you a long way, friends. Now, these are few of my followers who had followed this daily schedule, and they've understood and they've improved their health, friends. Now, friends, these are all the best of the videos available. These are I have last my 8 years research, and I have invested lots of time, more than 5,000 hours. And my understanding, I try and give it to you in such a short way so that you can learn in a 2 days time frame. And this is what my name is Gangeshwar Rao, friends. I retired as a general manager in Escorts Limited after 34 years of service. I was taking 11 medicines until 2014. In 4 months, I was able to get rid of my medication, and I have done a lot of research and I guide people free of cost. Look at these are the parameters. Last 8 years, I have not done medication at all. I'm hale and healthy, and I wish you also become hale and healthy. Understand these fundamentals. Uh, Take appropriate diet plan. If anybody wants any guidance or support, you can always call on my WhatsApp number. Thanks for listening, friends. Please watch, lots of videos are there in my YouTube channel. Watch them, share to your friends. Thank you very much.